The opinions and statements made by the guests of the Success in Practice podcast are their own, and I do not endorse or accept responsibility for their positions. Any information given by myself or the guests is educational in intention and not to be taken as medical advice. If you choose to act on the content involved in the podcast, you do so at your own risk. Welcome back everyone to another episode of the Success in Practice podcast. Today I'm joined by Tim Taylor. Timothy Taylor is a Melbourne-based osteopath with over 30 years of clinical experience and a deep commitment to both hands-on care and professional education. A 1995 graduate of RMIT, Tim began his career with a clinical internship in Canberra, where mentorship from senior osteopaths sparked his passion for exploring the full breadth of osteopathic techniques. He went on to build a successful practice in the ACT, treating complex cases of chronic musculoskeletal pain before relocating back to Melbourne in 2004 to raise his 4 children closer to extended family. That same year, he founded Darling Corner Osteopathy, a thriving collaborative clinic that continues to serve the local community to this day. Tim has a particular interest in treating children and infants, especially those experiencing digestive issues such as colic and constipation. His work is supported by postgraduate training in paediatrics and cranial osteopathy, as well as participation in clinical studies through the Academy of Neuromusculoskeletal Medicine. Tim's passion for education and mentoring has only grown throughout his career. He co-founded Fit for Practice, a professional development platform delivering hands-on clinically relevant seminars for osteopaths. He also leads small group mentoring programs focused on modern techniques and managing common conditions, always grounded in practical, evidence-informed care. Building on his dedication to mentoring the next generation, Tim has served as a trusted table assistant for renowned international osteopaths including Louisa Maraglia and George Stillian, further enriching his clinical teaching practice. Whether in the clinic or in the classroom, Tim brings warm curiosity and a commitment to helping others move and feel better. Tim, thank you for being on the podcast, mate. We spoke yesterday and you're a little bit under the weather, but it looks like things have cleared up. So I appreciate you making it tonight, mate.
Yeah, no, I just had the influenza A virus 2 weeks ago, which is not to be recommended, and it's been a bit of a haul, but I'm back and feeling better. So
lucky we can't catch that over the internet, mate.
No, exactly. I'm just going to make you
something new. You never know, right?
You never quite know, but I'm just going to make you a little bit jealous because I know Melbourne. There's the fire running for me, just to make you that little bit jealous, because I know Sydney's. Sydney doesn't get that cold, does it?
Mate, we're 28 degrees here today.
You're kidding me.
You're 28, 27 degrees here. It's like summer. It's God's country up here.
I'm going up to the Gold Coast this weekend, and it's going to be 21, so I'm looking forward to that.
Yeah, no, jump in the water there.
Melbourne has definitely dropped into the winter, so...
Yeah, right. Tim, I'm going to get started by asking a bit about your background, and I guess going back to your early days, your childhood days and high school, and what was your family life like, and then what ultimately took you to osteopathy?
Well, as a child I was very active, probably undiagnosed ADHD, loved playing sports, loved climbing trees, loved getting myself injured, and through those amazing days of running wild in the streets, which was Melbourne in the 1970s with 2 older brothers, I loved exploring life, and played quite a lot of cricket, and had a few injuries in my back, and had seen a few physios during that period and a few chiros in that period, and didn't particularly like either of those professions. And my family folklore story was my mother's father was he unfortunately passed when I was 3, but he was a First World War vet who got injured in the Pozieres and lived in country Victoria, and basically was the local town massage therapist and sort of local healer. And so as a child would hear about the stories of my grandfather. His nickname was Coog, but he apparently had these electrical hands which would massage and fix all the locals. he treated Ghazali back in the 1940s and 30s when he was injured up there and found his way up to seeing my grandfather, and so I had an interest in sort of manual therapy of some degree as a child, and I found chiropractic a little bit too aggressive and perhaps spent more time in the waiting room and less time in the treatment room, and physio, the whole machinery of, back in the 80s you'd have the suction caps and different ultrasound machines, and it seemed like hands-on wasn't really the done thing, was very much that machinery based, and multiple rooms going, and it was a bit more of a triage style treatment, which wasn't really my thing. And I was more I loved reading Sherlock Holmes as a kid, and was more interested in sort of solving problems and intrigue, and I loved unsolved mysteries and had a interest in the peculiarities of the unknown facts of the world. And I got my brother's wife's brother. My brother's wife's brother was a chiropractor who suggested I go out to the RMIT course and check out chiropractic, and I thought I'll go out there and have a look. And as we were driving down the driveway, there was a sign which said osteopathic unit, and my mother was a sort of medical receptionist and had a few days when I was sick. I'd often go into the Alfred Hospital and hang out there, and had enough to know that pathology was the pathology unit, and osteopathy had some form of medical knowledge, and I thought better go and check out what osteopathy was. And I walked in the room and spoke to I think it was John Pritchard at the time, who was an amazing osteopath, who spoke to me about what osteopathy was, and it was just like bang, the lightning bolt had hit me. Like everything I didn't like about other manual therapists was exactly what osteopathy was. So it was a bit of a moment of like, oh my god, I've found it. So it was a privilege, and I didn't have chemistry in my year 12, unfortunately. So did a year of science at Melbourne Uni to get my chemistry and physics up, and then transferred into RMIT in 1990. And when I entered, I was the first when we were in first year, we were the first complete set of students for the course, because I think the course started in 86. So the first year course, we had amazing Margaret Matthews and Jerry and Mick Kelly and Glenn Bales and all those sort of legends of the field now, who were the very first graduates of the RMIT course. And we made up the last of the course, which was a nice feeling, and to have a final sort of sense of like, we've got a full course here. And compared to the chiropractors, our numbers were well under. Like we had 20 in our year, and I think the first years had 10 to 15 students. So it was a small course, and everyone knew each other and everyone looked out for each other. Because the chiropractors had about 60 to 80, I think, students, so they were much more. When you'd walk into those anatomy lectures, we'd sort of the osteos would be creep around the back, and the chiros would be swarming in there and in numbers. But we still socialised with the chiropractors, which was a bit of fun as well. Friendly into rivalry between the two professions.
Tim, did you go straight from high school into osteopathy, or was there any?
So I had pretty much did a year of science first, and then straight into osteo. So I was 19 when I started.
Were you kind of one of the younger people there in that course, or were there mainly mature age students?
There was about a third mature age, and about a third people who were my age roughly, and then a third who were a couple of younger guys and a few older guys. We actually had privileged enough to have Ray Myers in our year, who ran the RMIT course for many years. And Ray was a legend of the profession. Sadly passed away too early for us in our profession, and ran the course for many years and was a definite a legend of the field, and sadly missed.
And was there an interview process at the time for you to kind of interview as well?
We did, yeah. It was I think the stats were somewhere between 200 students were applying for the 20 places, so it was pretty hard to get into. And I remember doing the first interview when I didn't have chemistry, and the look on their face when I finished that interview, and I sort of said, I haven't got chemistry. There was a bit like, that's been a waste of time, but go and get out. You got to go and get your chemistry. And come back in, and the second interview was a much easier experience because I walked in there and said, I'm back again, I'm not giving up, I'm going to keep going until I get into this course. And
you had chemistry.
And I had my chemistry. So
I always wondered why they asked for chemistry. I mean, it's a weird one.
I think it was basically, from what I understood, it was the course structure was based on the whole medical course. And we had it was the 5-year program, but we had at least well over 1,000 hours in that course. And they wanted the level of education to be at its best. And obviously we did chemistry first year, and we did biochemistry in second year. So we had biophysics. It was very much a science stacked course.
Yeah, so physics I understand, but I mean chemistry and especially carbon chemistry, it's like, it's I don't know how much of that is still relevant.
Yeah, look, I think for pharmacology, when we're in third or fourth year, it made it a little bit easier. But it wasn't. I think they thought, right, well, you guys are going to do and the chiros had established that's a framework. So
yeah.
But yeah, I struggled with chemistry, but I eventually got there.
Yeah.
But it was a great memories of a relatively small profession of those student bodies, and I had lucky enough to have some good friends. It was every year centre interconnect, and when I was at a student clinic in third year, the fifth years, I had Michael Solano, Bruce Duncan, Shane Heslop. They were the sort of Pili Munoz. They were some of the osteos who were the year or 2 years ahead of me, who nurtured us as we took over their patients. And so there was already mentoring happening in the profession at that level as students, because those guys would, you'd be watching them treat, and because the course was 4.5 years at uni, and the last 6 months you spent was doing a preceptorship, which was basically going out into a clinic and working. You had to do a minimum of 1,000 hours observation and treatment. I think it was 100 treatments and 1,000 hours of observation. So it was pretty full on again. So it was basically 9 to 5, and got paid the equivalent of the dole by that time, which I think was about $90 a week in 1994. So there wasn't many. When I graduated, the 90s recession had hit, and there weren't many jobs in Melbourne going, because those 4 years ahead of me had got the prime positions.
The one we had to have.
The one we had to have, yep. So my friends and I just thought, right, interstate, here we go. And Sydney had been an option, but then I heard about Canberra. There was a position going there with 3 osteopaths for the 6 months, and had the privilege of working 1 day a week with Malcolm Jack, who's a legend up in the DY area.
Yeah, he's up on the North Shore here in New South Wales or Sydney.
Yes. So worked 1 day with Malcolm, who had a program treating kids with cerebral palsy. Yeah. And during my student days, I actually worked at Urella as an attendant care worker, and that was my sort of job to keep me going through my student days. And working with a lot of the children, it always found it quite harrowing to see how much pain and frustration and disability a lot of the children had. And in my interest, it was always like treating cerebral palsy was always a bit of a interest.
It's a funny one. I'm actually treating one of the adults, or he's an adult now, who was a patient of Malcolm's when he had cerebral palsy as a child.
Oh, right. Okay. Yeah.
So it's interesting because he recalls Malcolm's treatments, and Malcolm loved his hip tugs.
Yep.
And so, shout out to Malcolm. We'll try to get him on the podcast. I think he'd be a good person to talk to.
He'd be amazing. Yeah.
Yeah.
It taught me a lot.
Before you go on, Tim, I want to take you back to your university days, and I guess I just want to ask you about some of the more memorable things, or what really stuck with you. Were there any turning points in that time where you any aha moments where you really understood osteopathy and you were just bought into it? Like, was it from the get-go? Did it take you, a year or two to kind of find your feet? What tell us about your experience more so in terms of just becoming an osteopath and I guess being a student of osteopathy.
Yeah, well, I look back at our teachers. We had some pretty amazing teachers. We had Cynthia Tucker, who was a English trained osteopath who came out to Australia to retire basically, and then the course was, from what I can understand, was starting to fall apart, and Cynthia was asked to come in to take over as head of the school, and she had been working as an osteopath for Wimbledon for many years, and had treated Ivan Landau and John McEnroe and all those guys. So she'd always had some great tales on treating them, and she was definitely someone who you didn't want to cross. She kept you on track, and we had Jerry Benish, who taught us high velocity, and Jerry was another sort of original osteopath who came out from Czechoslovakia. His daughter Eva still practices in Melbourne, I think. And he was an incredible high velocity practitioner, and Patek wasn't the greatest teacher, because often he would just his idea of teaching was, okay, you pick up the neck and you do this, you get this, and it's like this, the quickest hands you've ever seen, and these incredibly big hands, but lovely man who he always had success in his practice. And I remember asking him, I said to him, how do you know you always fix your patients? He goes, because I treat them once and they never come back. But he had that attitude of, like, he wouldn't rebook patients. He would treat them, see how you go, call me back if you're not fixed. And the guys who he would never see, I'm not sure how well they went, but it was definitely a life-changing experience for a lot of people, and his skill levels of his high velocity work. And we had other people like Peter Verhoff, who again was an ESO trained osteopath, who I was quite interested in, sort of quite indirect work at the time as well, and he was another mentor in that period of exploring the treatment of sort of more the indirect work. And we had Maxwell Favale, we had Julie Fendel, we had Ivan Lullerman would come down and teach us MET and visceral osteopathy. So Ivan would basically fly down on a Friday and work and teach he'd teach the third years, I think, in the morning, and the fourth years at lunchtime, and the fifth years afterwards. And he was another inspiring osteopath who, obviously, when I went to Canberra, I was fortunate enough to connect more with him. So we had a huge range of different teachers who were great.
I want to ask you about the role of inspiration in that whole process. I mean, how important is it that a student isn't just given the subject matter, but is actually inspired by either by the person that's teaching it or by the material itself?
So important. So important. I mean, just going back to Ivan again. Ivan, his stories he would always tell were pretty amazing, and I'm sure today's APRA would have a great time contesting what Ivan would be doing with his treatments, but he certainly had some amazing results. And I actually treat a lady here in Melbourne who used to be treated by Ivan back in Sydney for her asthma, and she tells the story of how she was treated every day to get her asthma to working, and he had that almost a program where he would be would work on someone's lung fields and chest and diaphragm on a daily basis, and he charged, I think, one trip consult fees for the week, but basically got her in every day for those short little treatments, which is almost the stories of when you read about A.T. Still. He had similar sort of concepts where he would do his rounds going through the villages and he'd treat anyone with pneumonia. He'd be treating them every day, and wouldn't charge, or very minimal charging for the fee structure there. So it's interesting how when you hear those stories, it's like those people, it's not about the money, it's all about the getting people better and establishing health in the body.
I think they really wanted their trade to work. Like, you know what I mean? It's you said it right. It's not about the money, but it's not even about charity. It's just about them knowing that I must do this every day. Like, they have understood the frequency of their treatment had to be at a certain level for it to actually work effectively, and then they understood the body's capacity for healing, which is all part of our principles. And they understood that, and that's why they were doing it. It wasn't to be charitable, although they were charitable. I think the main focus was more on the actual application of osteopathy, and making sure that they did that well. And that's an important thing for everybody to kind of take away, is that you need to really take pride in what you do there on the table, and also in the result that you try to achieve for the patient.
Yeah. And there's no real, we like to think there's formulas on our treatment outcomes and stuff, but sometimes you do have to treat patients twice a week to get those changes. And I've probably got the issue now where I've been booked out for several weeks. It can be hard to manage those patients, and it ends up you fitting them in your lunch breaks or your short little breaks, or try and get my associates to treat them as well. So collaboratively try and work with them. But there are some people who just need sort of regular treatments.
You're doing that, Tim, because you know they need it, and you know that if you don't do it, it's not going to work, and that's going to be that's not good.
No, exactly. But getting back to those student days, it was a lot of fun, and I think the fact that the course was so close between all the different years, and it's so sad when I have some of the students come and talk to me who I have fourth or fifth years, and they talk about, do you know this guy in fourth year, who's in fifth year, and there's like, no, I don't know them, never. It's a big cohort now, and they tend to know their sort of small little groups which they work with, but we're as a very intimate course, and many fond memories of we had a few pub crawls which we'd do for and yours truly was often the guy leading the way, which was always fun to get all the different years together, and it was called the OSA in the day, the Osteopathic Student Association, before it became SOMA. But the meetings were always, we did a few crazy things like the Dragon Boat. We went up to Sydney to do the Dragon Boat Festival, and ended a team there, and none of us had done dragon boating before, but we thought, let's go up to Sydney and we'll get the osteopathic dragon boat team, which was a bit of fun. After the pub crawl.
Yeah. Mate, I can empathise with your experience. We had a small cohort at UWS when I was going through, and we were the second year through, and we knew the people that were, ahead of us and also behind us, because I guess it was such a small cohort that you could sit there and talk to people, and you kind of, like, as you were leaving your class, they were coming in, you'd sit and have a chat. And you looked up, I think you looked up to people too, like, if you're in second year, you'd looked up to those fifth years, they were doing, they were like about to finish, and you wanted to be where they were, and I hope that kind of culture can come back. I want to fast forward to your, you were talking about you made it to the ACT.
Got to Canberra?
Yeah, you went to Canberra after you graduated, and so tell us about that experience. What happened there?
Yeah, so we had to do the 6 months that was called the preceptorship. So I worked with Malcolm Jack 1 day a week, and then John Gledhill 2 days a week, and Steve McGowan, who's another amazing osteo, 2 days a week. John was fortunate enough his mentor was Kay, who you were just talking about before. And he treated, you'd call him
McPherson, that's it.
Kay McPherson, yeah. So he worked under her, I think. So we treated a lot of the raiders. So during the time we're treating, Mel Meninga and Ricky Stewart and Laurie Daly, those guys who came to the clinic. And so it was great to have the experience of those big guys, and some of the younger Maori guys who just had these huge bodies, but a lot of hard tree trunks, but great work, and they're very appreciative of our treatment. John had great skills with his palpatory skills with soft tissue stuff, so particularly just like managing those sort of hamstrings and the calves, and that sort of integrating it back into whole body mechanics was his specialty. But taught me the ability of just that early days of just the importance of palpating what you're actually doing, and the layers of, I can still remember him talking about sort of layers of strains, where you might get a superficial strain, say for instance for your soleus, and then going deeper in, or gastroc, and then going deeper into the soleus to feel the deeper strains, and how it's important to don't just treat the gastroc, because you've got to get deeper to get that really the sort of restrictive areas through there. So very fortunate having him as one of my mentors. And then Steve McGowan, another a guy who you should consider having on your show, because Steve has a wealth of knowledge, particularly with the connection with America. He's been to many of the American academies, and he worked with Anne Wales and Edna Lay, who are these some of the gods of osteopathy in the cranial field. And so Steve worked with them and has got the most amazing history collection of books. So if you ever get down to Canberra, it's worth giving him a call and saying, hey, do you mind if I pop in and have a look at your books? Because he's addicted to collecting the old texts, and it's got all the academy books, and definitely lots of videotapes which no one has anymore, but he's got a lot of the old convocation tapes which are great to get hold of as well.
We'll get him on the podcast. We'll reach out to him and see if we can get him on an episode.
Yeah, so I think I was fortunate enough having those three osteopaths who are very different in their style, but same concepts of the importance of working with the body and belief of what you can actually do with patients. And I suppose from those three, I've sort of moulded my own sort of preferred styling, which is probably a cross between those three.
Yeah, right.
Yeah, but
okay. And so, what drove you away from the ACT, mate? Was it just the cold weather?
The cold.
You must have gone to much warmer weather in Melbourne.
we had twins up there. Had Miles and my twins up in Canberra, and having twins without much family support was hard work.
It is.
And I had the clinic itself was myself and John eventually formed a clinic, and we had several associates going through there, which we had about 4 rooms going, and quite a successful practice. But I always promised my wife we would get to 10 years and would move back to Melbourne, and she was quite homesick. And to my name, I basically met up with one of my old friends, Miranda Cox, who she was a couple of years behind me at uni, and we were doing a Jim Jallis course up at the Blue Mountains, and she whispered in my ear to say she's looking for a locum because she's just fallen pregnant, and would you consider coming back to Melbourne? So Miranda gave me the carrot to sort of, okay, well, I can work there. And she had a clinic called Osteo for Kids, which she had established, and was a paediatrics of specialty clinic. And that was where I'd sort of, with my own children, I think I got more into treating, paediatrics with having my own kids, and the twins in particular. They were interesting to work with, between their sort of breech presentations and their transverse presentations. And we had in Canberra also had Maxwell Fravel, who you would have heard of, who's one of Australia's leading sort of cranial practitioners and paediatric practitioners. The kids are all treated by Maxwell, and he also would do workshops for us when we were in Canberra with the group of colleagues. And so Maxwell was another mentor who I had up there, which is amazing. And of course we had Avan as well. So it was quite a great experience of having such good colleagues to work with. And 10 years in, I was booked out for 6 weeks, and almost to the point of couldn't control. It was hard to work out. We're in June now. You'd be thinking, what if I want to have a weekend off in September? What am I going to be doing? And it was sort of also that probably burnt out phase of my life.
I guess the lesson from the ACT, it's a funny one, because you're talking to me now, and I can imagine, having Avan, Malcolm, John. You mentioned someone else as well.
Steve Webb. Steve
Webb, but you also said that you were treating a lot of the Raiders because
John Gledhill.
John Gledhill was kind of had that connection. It sounded like, I guess the ACT is it's not Sydney and it's not Melbourne, but for such a more of a concentrated area, there would have been a wealth of osteopathic experience at that particular time, right?
There was, yeah.
And so you'd think that it may have been very hard to, I guess, make it there as a new graduate or an early career osteopath. But in saying that, I think the lesson is that the more good osteopaths you have around you, I think the more work that it generates, the more clients that people want to come and see you. Would that be correct, Tim?
Yeah, well, I was fortunate enough of being the first osteo there in like 10 years when I moved there, the first new osteo. A lot of those guys, just when they were booked out, they didn't have associates themselves. A lot of them worked by themselves, and they said, "Go and see Timmy T. He'll sort you out. He's a new grad." And I would spend time observing with them, so I knew what style of practice they worked with. So I was lucky. There was that quite a collaborative sort of attitude of like, it was not so much competition. It was more like, well, I'm booked out, so go and see Tim. And Canberra, you pretty much at the time, you're 20 minutes from anywhere in Canberra. Like I was in Deakin, which was pretty much the central part of Canberra. So I'd treat patients who all lived within that 20-minute radius, and they'd drive into Deakin. It was park out the front. It's pretty easy. It's like a country Deakin. It's like a country town. And you treat the neighbours, and then the neighbours' cousins, and the cousins' cousins, and before you know it, you've got a whole web of everyone interconnecting. And word of mouth was always didn't really do much advertising at all. It was just that country town attitude.
Did you try, I guess, and emulate a lot of the people that were your mentors? Was there a conscious effort to kind of like emulate them, then, which is a very smart way of going about starting your career. Did that happen, Tim?
It was like Malcolm's treatments, Malcolm's patients who I'd be treating. They would expect sort of high velocity, and he was a great teacher for me as well, just helping getting me up to skills with my high velocity stuff, and taught a lot of the style which we weren't taught in Victoria, because the British School of Osteopathy was a slightly different sort of concepts of high velocity, and the ICO graduates talked more about open and closed facets, which wasn't taught back in Victoria. So that was another great experience for me. That's the way I've now worked on. That's conceptually about dysfunction and when you're actually working on it. So, and that was probably more the American influence back into the ICO, because they would often get visiting. They had like Paul Kimberley. They had some other. I think Ward might have come out as well, who was another great adjuster. He came out to teach. So they had the ICO itself was probably influenced a little bit more by the American school, as opposed to the British School of Osteopathy, which is what the RMIT course was influenced from. Yeah. So it's sort of like, and when I did come back to Melbourne and was sort of talks, showed some of my manipulations to my colleagues in Melbourne, they'd be looking at, who taught you this? I go, well, that's just done up there. Like I often do few supine adjustments and cervical supines occasionally. That wasn't the done thing in Melbourne. That's what didn't seem to be the done thing in Melbourne. And like it was. When you do get those referrals from patients, you'd sort of generally work in a way which you knew that those patients would respond to, because that's what they were used to.
Yeah, which is like I said, it's a good lesson for people today who are working in large busy clinics, and if you're obviously getting a patient that's been seeing another practitioner that's done very well with them, it's not a bad idea to kind of try and emulate what's going on, at least in terms of the general approach of what to do. And so you came back to Melbourne, and I guess straight away you got into your own practice called Darling Corner Osteopathy, and that was in 2004, I believe.
Yeah,
you've been there since. Tell us about starting that.
It was I had 3 days a week doing osteo for kids, doing Miranda's locum. Excuse me a sec.
Sure.
And then so I had 3 days doing Miranda's locum for a year, and then I had 2 days a week working just to try and build up Darling Corner Osteopathy, and it was amazing how many of my Canberra patients referred me their cousins or their friends who lived in Melbourne. So it was often that sort of, again, word of mouth. And then I worked near the local railway station, so people would walk past me to get to me. And so, reached out to local GPs, didn't get a great response, to be honest. Local massage therapists and yoga schools, they were and naturopaths, they're the guys who I tended to hit on to educate about where I came from. And I suppose having that 10 years experience and being busy over that period, I could say that I was, experienced compared to some of the Melbourne osteos who were, struggling to get their numbers up. So over that period and through the 2000s, because osteopathy really wasn't that well established in Melbourne through the 90s at least, and it's getting obviously now bigger and better, but those early days there was still a lot of patients who you'd bump into, say, I'm an osteopath, and they'd sort of say, an osteo, what a... So they were still trying to work out where we fit into the health scheme.
So obviously you had some experience behind you, and coming into a market where osteopathy wasn't as well known as what it is now. What were some of the challenges that you faced in, I guess, building up that practice? Like, what did you find were some of the bigger challenges that were ahead of you?
Yeah, I think, massive ego challenge for myself, in the sense of being in Canberra, booked out for 6 weeks, and a great following, to suddenly go back to Melbourne where I'd be seeing, 2 or 3 patients a day, and it was probably a psychological challenge to keep pushing yourself up there, but it's just slowly but surely. A lot of family and friends helped out as well, of course, and had the young kids, so we'd sort of often be, socialising with the kids from the local kindergarten and then the local state school and stuff. So with that, we were living in the same area, so the primary school became a good referral source as well. A bit of sponsorship to the local fete, and give away a few treatments, and you get one family in, and then next thing you know, word gets out, this osteo's good, he does children, and so that's actually started. I did my postgraduate grad certificate in manual therapy, which the Victoria University was running, which was in 2010. So I'd been back for about 5 years and had been treating a lot of children, but I thought that grad certificate would be just another way of just sort of giving me that sort of certification in paediatric work, which again, that took up quite a bit of your time, and having the young kids, and all the kids were getting a bit older, but balancing out running the clinic and then studying was always a bit of a challenge, but it was good. I've always been a bit of a probably workaholic, so it was always good to keep myself busy.
Tim, whilst you were building up that practice, I guess, and you mentioned that you sometimes you were used to being very busy in Canberra, and then you went down and started, and it was like 2 or 3 patients a day versus a full listing in Canberra.
Yeah.
What did you find that you were doing within your business and your business structure that helped you, I guess, make it through those early days where there wouldn't have been a huge amount of income coming in? How did you structure your business to make sure that you were running really lean, so that you could, I guess, make it through that early time it's a bit difficult? Yeah,
so literally I just had a single shop front which had had no receptionist. It was a small, you walked in the front door. My treatment room was in the front area there, so you walk through a corridor into a waiting room behind that, so I could hear the patient come in, the next patient, so I knew they were there. And I didn't have a receptionist for at least probably 4 years, and then luckily the shop next door came up for rent, and I was fortunate enough to get hold of that. And by that stage, I was starting to get busy, and I'd been there for about 4 years. And the day I was still working over at Fairfield 2 days a week, so I had had 2 associates who worked the room when I wasn't there, so they were building up their client base. And so when the next door space came available, we sort of got a wall between the two, and sort of had 3 rooms, which was great. And then took on a massage therapist who was a friend of one of the other osteos who worked there, and so she had a bit of a base to bring into the clinic. So that was always my concept, where I liked the idea of working with other professions in the clinic. And so had the massage therapist and the osteopath and 3 rooms, and it's just that incrementally built up slowly but surely. But it was. I think that was the way it was done back then, where you start slow, you keep your overheads down, you run really lean, and then you
you've got your manual skills behind you that really set you apart in the health space. Like, you know, you could tell. I mean, you could tell the difference between what an osteopath was doing and what a physio was doing and what a chiropractor was doing, and that really helped you. And I guess you could just wait for it to build up and build up. I don't know if it's the case in today's environment where you can kind of do that. We'll talk about that in a minute. But and so you're currently practicing still there at the moment. It's the same practice. You're still going, which is great. And you're mainly treating, I guess, infants and children, and you're quite interested in the digestive issues, especially colic and constipation. So I want to ask you, what you mentioned earlier that having your own children kind of led you down that path. What kept you down that path? Like, you know, what is it that you really love about that demographic that may not be obvious to the listeners?
Yeah, look, I think pediatric work it's a privilege to be involved with. I recognise that, and with new patients who when mum and dad come in and with their baby who's, you know, maybe three or 4 weeks old, who's not feeding very well, and generally the mum's exhausted because she's either had a bit of mastitis or she's, you know, not feeding very well. The baby's not sleeping well. The babies might have a bit of constipation, or it just might have an upset stomach with, you know, reflux and or colic. And, you know, I always sort of make recognition to the parents and in a way of saying thank you for entrusting me with your beautiful bundle of joy, which is the most precious gift that you've created, and I really appreciate you trusting me.
Sorry, I don't mean to. I've got a 6-month-old at the moment, and so
have you?
Yeah, I do. And you sell this beautiful bundle of joy, and when she keeps us up, I'll tell you what, it's.
Look, sleep deprivation is a quick way to insanity, isn't it?
It is.
Yeah, and I mean, I think particularly with pediatrics, it's generally speaking,
it's torture, Tim. If there's no child there, it's actually torture. But anyway, I'll let you keep going.
Exactly. No, look, it's a privilege, and I think most of the children I work with tend to get better quite quickly. So, you know, 2 or 3 treatments, there's a positive response, or if there's not, then you start looking elsewhere about why that's not happening. And you know, it's a privilege just to see babies get better quickly, and the mother coming in better because the baby's feeding better. It's less colicky. It's you know, and that makes a happy families all around. And it's, you know, often mothers give some of the mothers a bit of a treatment when they first come in, because I would say, look, you know, those ribs aren't working too well. You've got a few issues there. Let me just do, while you're here, let me work on the ribs and get your diaphragm working again, because after you had that baby setting up through your diaphragm, that's not working through here, and it's going to decrease your stress levels and get you feeling a bit better. And the next thing you know, they come in next time, they go, baby's actually pretty good, but you know what you did last time on those ribs, that really helped me. Can we like do like a mini? And so again, there's, my running joke's always been, there's more money in the broken mums than there is in the babies. Yeah. So it's important to help them as well.
I said that to my wife last week. I said, babies are cheap, mothers are expensive.
Mothers are expensive, yeah.
That didn't go down very well. Mate, I want to just, I want to make a point to what you said earlier, because there's a common misconception out there that because obviously babies can't, you know, they can't talk to you, they can't give you a history, you know, and you've got to kind of do some investigating, and you've got to kind of, you know, go looking a bit deeper, or maybe, you know, try to figure out what's going on without much communication with the patient. The misconception is that it's maybe a difficult demographic to treat. I think it's quite the opposite, because you don't have those layers of dysfunction that adults have built up, especially neuro-emotional stuff. I mean, when you've got a child in front of you, a baby that's, you know, an infant, or someone that's a toddler, or you know, you've got a 7-month-old in front of you, you know, they haven't had a car accident generally. They haven't, you know, built up all these layers of dysfunction that you've got to peel away. You know that you're working with a very fresh nervous system that is gonna respond actually quite well to your treatment. And you just got to figure out the mechanics behind it. And what I mean mechanics is the actual mechanics, whether it's the neurological mechanics or the physical mechanics behind it, and treat that. And if you do that, you actually get better results than what you get with adults. Would you concur with that? Do you think that there's a misconception out there, and do you think that it's not as bad as what people make it out to be? Hello everyone, I'd like to take a quick moment to thank everyone for watching and listening to the podcast. If you have received value from this episode, the kindest thing you can do for me is to like, share, follow and subscribe to the channel on whichever platform that you are listening on. If any of the conversations have resonated with you and you feel that I can help elevate your practice, you can find me at successinpractice.net. That is, the Success in Practice program can be found at successinpractice.net. The Success in Practice program is the signature program that takes a practitioner who may be struggling with retaining patients. They may not be certain about building effective treatment strategies, and they may feel somewhat anxious and doubtful about what they are going to do with a patient. And they are not really accelerating in the real world of private practice. It takes this practitioner and it turns their careers right around to the point where the patients have an effective diagnosis and a real treatment plan that they can take home. Patients are happy to book in multiple sessions with you, and they are confident about your abilities. And more importantly, you now have direction and are confident about your own abilities. The program streamlines how you operate as a practitioner. Guys, you should have been taught this at university, but you weren't. You may have been practicing for the last few years thinking there has to be a better way. There has to be a more effective way of engaging with patients and getting them results. Well, there is. And this is what the program delivers. Go to successinpractice.net and check out the options available to you. See where I can help you easily grow your patient list and finally earn the rewarding income that you deserve. For all the information on how you can reach me personally, check out the show notes. Also in the show notes, you'll find a link to the chat transcripts from these podcasts. These are valuable and a wealth of information. I really hope that you're enjoying the podcast. Guys, leave a comment if there's any questions on this episode, and please, don't forget to like, share, follow, and subscribe to the channel. Now, back to the show.
What I like to do is examine the baby, obviously, on the table, or sometimes on a pillow with the mother. And when you're actually just doing observation, you're looking for those positional changes. And often babies present. You just take your time to look, and a baby's got a preference. So they might be looking to the right. Their shoulders, might be rotating to the right, side being to the left. Their left shoulders drop down, and their pelvis might be C-shaped curve through there, and their pelvis is rotated. And you look at them, and then I often say to the mother, "Was your baby kicking up into your rib cage up here?" And they were going, "Yeah, exactly. How do you know that?" And it goes, "Well, that's where, if you look at there, if you bring your baby upside down, and was it posterior, was it anterior, or which position?" So I often like to recreate the baby's position side in the mother, and then she herself can see, "Oh yeah, that's where Bub's bum was always up here. It was kicking back in my ribs through there, and that's where she engaged early in the presentation." So their head down was into the pelvic bowl quite early, and so therefore their head's going to be rotated. And so once you explain it to parents, that they go, "Oh, that makes a lot of sense." And the way I treat babies is basically through BLT, balanced ligamentous tension technique, which is really just basically getting the body into a neutral position and let the babies almost like treat themselves, where you'll be amazed how getting into that neutral position, you'll see a hip which is sometimes restricted. They'll start to kick, and they'll start to move, and they almost like go, "You're holding this position," and then that baby will start to go, "Oh, that feels nice. I like that." So the treatment's incredibly gentle, as you would be aware, and it's that unwinding process which babies, we're just like almost like the facilitator for a baby to unwind, and holding a pelvis in that neutral place, and then even like doing a little bit of a bit of mobilization on a sacrum. You'll feel that there's that rotation there, and then bringing it back into neutral. You can hold it, and then you'll start to feel the tissue start to soften. So it's again, some people get scared of treating babies. To me, it's a gentle process, and it's working with those ligaments which haven't had that, as you said, haven't had the issues that they've always been emotional connections or dysfunction.
Or someone just hasn't. Yeah, the kids haven't. It's not like they've been running for 10 years. Doing 20 kilometres a week. They don't have that hip degeneration. They don't have all the issues with capsules and. So and everything you just described there, Tim, it's all very mechanical, and so you can assess that. That's literally the core of what you do as an osteopath, and so you can assess that. You can find out how to treat it, and you could potentially really do very, very well doing it. And I just want to try to destigmatize that particular demographic, because we feel like we've got to do specialised training in paediatrics, and yes, you do need to understand some of the assessments and so forth, and the development stages. But that's not going to be any harder than what you did at university. If you're keen on that, go ahead and learn it, and get right into it.
Yeah, I think I'd love to think that you'd have osteopaths at a level which they can come out from university. I know paediatrics isn't really taught anymore. As far as I'm aware, at the universities, or very basic stuff is, but it'd be nice for babies. I was often say to a student, saying, say you go for a drive through Australia and you get to the Malabar Plains, and there's a little Aboriginal community there that there's no osteopath for 5,000 kilometres away, and there's a mother there who's got a baby who's not feeding very well and has got colic and got vagal irritation, and it'd be nice to think that most osteopaths could take that on as going, okay, let's just have a look at what we can do to help improve this baby's function. And it's it's not rocket science, but it's something which you can work with in a really gentle fashion, and not be scared of actually treating babies, because there are graduates who say, we're not trained to treat babies, which in that situation it's a basic osteopathic skills really, but you obviously want to have some education. But
I mean, they're little people at the end of the day, and they're the laws of physics act on them just like they act on us. It's just that their tissues are a lot more malleable, and they're easier to release because they want to be released. They're not holding on to stuff. There's an innate ability for your body to, when you go back to the sort of embryological development of the child, that's being aware of that. It can definitely be a way of assessing someone and just realizing, allowing the body to express itself and get the fluid working through the system. Tim, let's say I'm somebody who wants to learn about treating pediatric or treating in the pediatric space. If you could give me some advice, where would I start? Like, what's the what course do I do? Do you have any good suggestions? Like, where do I start?
That's a good question. I know I can do a bit of a plug now. There's an Italian osteopath who's coming out later in the year, Dr. Luisa Maglieri, who's through the Bowerbird program. She's doing I think 2 weekend courses where she's coming out to teach treating babies' stomach, and it's called, she's doing plagioccephaly, feeding difficulties and upset tummies, and she's also in the 4th week she's doing neurodiverse outcomes with children. So that's something which they're weekend courses. I think they're Friday, Saturday, and then a Sunday and a Monday. But she's a specialist Italian osteo who works in Moderna, and she's in Italy. She's been working with children for about 20 years, and her last seminars were great. But I'm just trying to think of the other, from a local point of view, whether the SCTF might be running sort of introduction to treating children, but I can't really. And of course,
without learning,
George.
I guess. I'm not. Sorry, go ahead.
I was going to say, and of course, just George Dillian, who's got this weekend's actually got a module one being run, which is on module 1 pediatrics. So looking, George Dillian's got his Dig On program and runs it up at Tweed Head. So he's a wealth of information, and
George is.
I know you spoke to him a few weeks ago, and his programming is great, and it's starting this weekend. So I'm not sure that's probably obviously would be gone by the time people hear that. But
I mean,
look at these programs.
I mean, I guess the idea is that even if you feel like you're not, I mean, the indirect, involuntary kind of techniques do take a little bit of time to master. But I guess even if you feel like that shouldn't stop you from just getting into it, just understanding, I guess, embryology and understanding development and understanding just the mechanics and the anatomy and the presentations of the pediatric patient. Find somewhere, I guess, find someone that's teaching that.
Yeah.
Just start there.
I know Christine Fravel, again, I'm giving all these plugs away, but Christine Fravel is also running a weekend in end of the year, October, I think, and Maxwell Fravel's coming down to teach that, so that'll be fabulous to have time with Maxwell. And she's doing an introduction to pediatrics as well, so there's quite a bit out there.
So there's a bit out there. Just get started.
There's 3 courses. Yeah,
get started and just get your hands on babies. Get your hands on. And just move them around and see what happens. Pick something out, like what you described earlier, Tim, where you just observed. You looked at the head position, you looked at the shoulder position, you looked at the ribs. Just observe and move and see what happens and see the results you get. You'd be amazed, and then take it from there.
Yeah, no, it's definitely like it probably makes it's in a day I'll have somewhere between, if I say 12 patients, there might be 3 children and then three mums who. Or my bit of pregnancy as well, and then I've got elderly patients, and then the teenagers. So, my clinic's very much a general practice clinic with. So, I don't get bored ever thinking I'm just doing children, and I'll not that I get bored of just doing kids, but I like to mix it up with the whole range of different conditions, and from the elderly through to the young. Yeah,
definitely. I guess I just asked you a question about postgraduate training and where to start for pediatrics. Take us back to your own postgraduate training, Tim. What did you find? What did you find was really useful? Like, if you had to just pick a certain time in your career where you found, a certain postgraduate time where you just found like that really turned your career around. Could you give us some insight into that?
Look, I feel very, very, very privileged. I was invited to participate in a group of people called the Academy of Neuromuscular Skeletal Medicine, and that was set up with Dr. Terry Vardy, who was another mentor of mine, and unfortunately Terry has passed away I think 3 years ago now. And Terry and Professor Rod Alcoff and Kevin Portley, who are basically medically trained practitioners who had an interest in manual therapy. And Sydney University was running a master's program in manual therapy, which was ran during the 2000s and 2010. So that was actually for a course where medical practitioners could actually learn about manual therapy. And they would get out osteos to come out to teach them. And so the numbers there was 10 in a class of 30, they had 10 medical doctors who were learning manual therapy under the guises of osteopathy. And then they would have 15 to 20 osteopaths who were invited to join the classes. And because of my connection with Steve McGowan, I was allowed into join this group of guys who were quite senior in their age group. Like, I was probably in my early 2010. So I was probably 35, and these guys were in their sort of 60s and 70s. There was many of the old ICO osteopaths were there. And so I was lucky enough to start off with we had Dr. Anthony Chiller, who, do you know who Anthony Chiller?
I don't.
American osteopath who was one of the co-authors for this book here, which is Fascia in the Osteopathic Field. I've got a few books by my side here, which I'm going to pull out accordingly, Sammy. This is a must for anyone who's interested in the fascial system of treatment.
When was
Tony
that
Chiller.
book? When was that book written, Tim?
This was written.
I'm assuming way before fascia became the new.
Well,
thing.
actually, he was one of the early leaders of fascial treatment. This was actually done in 2017, along with the Italian osteopath Paolo Torzi, who I was fortunate enough to do his course last year when he came out to teach in Albury.
That the first edition that you got there?
This is the first edition. It's been well loved. But I don't think there's a second edition out there yet. But this is it's got such a great resource in any fascial. If you're interested in the fascial system, this is the Bible. And Torzi he's a fabulous guy who came out. But
just as a disclaimer, before we started, everybody, I asked Tim to just elevate his laptop screen a little bit higher so we could see him. And just to let everyone know, he did not use an osteopathic text to do that. It was, I think,
it was a world of history.
World of history. The history of the world.
History of the world was a big
history
book.
of the world. That's it.
Yeah. Anthony Chiller came out. Then we had Richard Van Bursk, who's a AT still expert, who has written the book on the AT still, the AT still, or the still method of treatment. So he came out. We had Jerry Dickey came out. We had Anthony Nichols, who was Alexander Nichols, who was head of the Philadelphia School of Osteopathy. We had Todd Dombrowski, who was a specialist in concussion, who was basically like a military doctor who worked for treating all the Iraqi and Afghani sort of soldiers who were coming back with concussion injuries inside their
you mean the US soldiers who came back from Iraq and Afghanistan?
Yeah, so there a lot of post-traumatic stress and concussion from their IEDs going off in their tanks and their vehicles and stuff. Yeah, so he's done a lot of research into the treatment of that. And so that period of my life was basically up in Sydney at the Women's College in Sydney, and myself and Danny Williams and Miranda Cox, who have become all friends, and several of my other friends in Melbourne have come up to that. And unfortunately, Rod Orkoff passed away, and Terry passed away within a year of each other. And the academy is currently on a bit of a pause while they're regrouping to work out where their future is. But yeah, I was very fortunate to have that for 10 years running, and having 3-day weekends with these amazing osteopaths from America.
Yeah, right.
So that was probably my highlight with and a lot of that work is I also had an osteopath called Tom Crow, who is the co-author with Terry Vardy, who wrote this book, The Masters of Osteopathy. And again, this is basically go through all the old school techniques between Sutherland and Wales. Sort of hard to see on the screen here, but this is again a very practical book with lots of treatment of the sacrum and the pelvis. Sorry, it's a really easy to work out, but a lot of it's BLT and mobilization, articulation, and it's Dr. Sutherland's techniques outside of the cranial motion, so to more extremity work. It's again, this book is a must for anyone who's interested in old school traditional osteopathy. Thomas Crowe was great practitioner who was a BLT or BLT teacher basically. So enough very fortunate to have had that period of my life with those guys.
Yeah, amazing. And so what advice would you give to people now that are wanting to further their training? I mean, what would be... I know there's a lot out there. I mean, there's stuff that you do and fit for practice. We'll talk about that in a minute. I mean, there's stuff that I'm doing. There's stuff that George Stillian's doing. There's stuff that Bowerbird are doing. Okay, how do we navigate all this stuff as I guess early career osteopaths? Like, where do we? I'm trying to be, impartial about it, and trying to get your idea about it. You know, the main thing for me when I look for courses to do, and I want to get your take on this, is that I'm looking at the person who's running the course, and the question that I ask is, can they display what they're actually teaching in their practice and show a track history of getting great results with it? And if they can't do that, if they're not doing that, it's probably best to look elsewhere. But if they are, and that's the way you want to head, whether it's HVLA, BLT, involuntary mechanism, pediatrics, whatever it is that you want to do, then I think that's my criteria. What's your criteria, Tim? If I'm looking for a course, what should I be looking for?
That's a good question. I think it's obviously what your passions are, what your interests are. You've got to be governed by what you're keen to learn about.
Well, let's say I found what I'm interested in. I'm looking for a course. How do I know that course is actually, any good? Or,
I suppose just a bit of researching on the speakers. Like last year, Paul Torzi, when he came out, he sort of was working. He went to Albury to teach the fascial course, which was over 3 days, and there was probably about 20 osteos there, and there was actually there was 4 dentists there, who Dr. Donny and his crew, who are a group called Myofocus, and they're interested in sort of the tongue tie dysfunction and dental imbalances, the oral facial injuries. So they were there actually because they're so interested in the fascial system. So it was an eye opener for me to go, oh my god, this expert from Middle East ended up in Albury of all places, which is probably, the idea was somewhere between Melbourne and Sydney, and the lady who organised that did a great job in bringing him out. I'm not sure how well that was, how people knew about that, but and I've been doing George Cillian's courses through these modules, his paediatric modules as well. So you've got to really look at the speaker, look at their background, how long they've been working with. But I suppose in my ballpark head, you want probably someone who's been doing at least 20 years, I think, of some form of education or knowledge to become interested in their expertise, lecturing. Yeah. I'm not sure. I could be wrong. Like, there might be a new grad who's really gone into specific knowledge and learned all about it. But I think personally, it's great to be. I like to be the concept of someone being
practicing though. Like, this is a. People argue with me about this, and they can. But I think you could learn a lot about something, but then you got to go and put it into practice and actually get results with it. Like, there's no point knowing about rehabilitation of lower back pain for whatever reason. I mean, I'm just plucked it out of the air, but and then you go and teaching that all over the country, but you're not practicing. If you're not seeing 30 patients a week with lower back pain and being able to demonstrate that you can get great results with the method that you're teaching, it's like, I'm not sure what it's like. I don't know how you could justify that that particular course. It's like trying to see an osteopath who can't, I guess, demonstrate their ability to get results for the particular problem that you're seeing them for. And so I would say that there could be new graduates, but I think you're right, Tim. I think having at least 20 years where you've been in the trenches doing the work, and not only just doing the work, but obviously understanding the theory behind it, really thinking about it, developing your skills, and then being able to pass that on to people. I think that's great. But you got to be practicing. See practicing osteopaths. Go and see practicing osteopaths. I mean, the best form of learning you're going to do is actually observation. But if you want to go do a course, then make sure the osteopath's practicing and doing it day in, day out.
Oh, look, that's how I think you're about to ask me soon about how fit for practice came about, and that really came about by the fact that we would have myself and Danny Williams and Miranda Cox. We were friends, and we basically would often encourage 50ers to come and do observations at their clinics. And both of us made commentary. All of us made commentary of the fact that I'd be doing sort of certain techniques, and I'd say to the student, you've seen this one? You've seen this technique, like for instance, something like the Spencer technique. Do you know the Spencer technique? We'd be doing say for a shoulder, we'd be doing specific work on the Spencer technique, and I'd say to the student, you've seen this being done, and they'd look at us like, no, I haven't seen that. And I go, okay, well, this is like classic sort of old school osteopathy. This is if you're in America, if you can't do Spencer technique, you fail your final exam. Like that's just the standard one you've got to be able to do. You've got to know the sequence of it. It's a repetitive action, but works really well for shoulders. Everyone should be taught that. And then we started seeing other techniques we were doing, and the students is looking at us like, what? Where do you guys pull these techniques out? And to us, it was just what we've been taught. And I think since the Friends of Science have got into, I can only really talk from RMIT because I've obviously got more connections there, but I think the course has been stripped back a bit, or significantly, on the level of what they're teaching, and there's a bit of mistrust about the importance of or the power of manual therapy and hands-on technique. And as we probably know, the profession's moving towards science-based evidence, which is okay, we're going to get everyone into exercise rehab, and this is where the evidence is, which I'm not really sure if that's true at all. But I think there's a balance between. I still like to give my patients exercises. I don't discourage exercises, but there's that ability to work the body and work the healing capacity.
Well, it's not the medicine, is it?
No, get the body healing, and that's where I think the word healing has almost been taken out of osteopathy in the courses, because it's like we can't talk about healing. It's like we need the science behind what's going on and stuff. So I'm rambling now, but
no, it's all right.
Yeah.
Well, tell us about Fit for Practice then. So you Miranda and Danny got together, and
we got together. So we had the students who were just observant, hadn't seen these courses. We thought, well, these young guys we've got to get them back to the traditional techniques of osteopathy. And then we would do evening seminars where originally started about 10 years ago, having a night course where every Thursday night between 5:30 to 8:30 we'd have 3-hour lectures going with a bit of a dinner break, and we'd be teaching them sort of an introduction to cranial work, just to start them, get their confidence about how to palpate. We'd be talking about sort of systemic treatment, whether we did a little bit of visceral work, and encouraging them to sort of discover about what you can do with viscera, because that had been cut out as well. And it was just like Danny, myself, and Miranda. We're three very different style techniques, but we've got the same philosophy and the importance of the philosophy of osteopathy. And we thought, well, let's make it into, why don't we get some of the older osteopaths to start teaching. And it probably started with in the first year we got together, we wanted some of the older osteos who were starting to retire. And the first guy when we wanted to move to a weekend intensive program rather than doing the monthly sort of seminars, the first guy I phoned up was Steve Porter. Because to me, Steve was the ultimate osteopath. He wasn't afraid to use all the different tools in the toolkit, and he, whenever I would bump into Steve, which is probably not enough in life, but the times we bumped into each other, he would inspire me, just even like with a 10-minute conversation, and he would basically, and he always said it's the philosophy of osteopathy which makes osteopathy unique and special. And training someone to have that osteopathic brain was such an importance for him. So I phoned Steve. I said, "Mate, we want to get him. We want to get Peter Cash, who I hadn't had much to do with, but was famous in the ICO. We're going to get him down. We're going to get Mark Keyworth down, who was another mentor for some of my colleagues, who was a great osteopath." and that's how we wanted to get these guys who are in their sort of almost like retirement phases of their lives before they pulled out. We wanted to get Roman Maslach down. Unfortunately, Roman had retired and decided it wasn't for him. So that was a generation of osteopaths that we were trying to get together, and it worked really well over a weekend, and it's sort of blossomed into now we're running it. This is our 4th year we're running it over a weekend, and this year we've had Michael Solano, who's actually he's actually spoke at all the weekend seminars, and his specialty is embryological sciences. So he always opens the lecture normally with a 2 hours of discussion on embryology, and then sort of the importance of arterial systems, and his specialty, which is I'll talk about that a bit later. But this year we've got George Stillian, who's coming down, Julie Pipers, who is a great osteopath in Melbourne, who is taught the high velocity program at RMIT for at least 10 years. We've got Claire Gordon, who again is another all-round osteopath who's really great, amazing with her involuntary work. Catherine Johns, who's a pain specialist doing pelvic pain from post-birth. I've got Matt Towers, who is coming from Adelaide, coming across. He's also talking about, so the actual topic for this year is the autonomic nervous system. So again, quite a broad topic. So Matt Towers is talking about the effect of the autonomic nervous system with external forces. And last but not least, we've got a guy called Grant Burrows, who's another good friend of mine, who's talking about burnout and running your practice in relationship to the autonomic nervous system and sort of ways of avoiding being burnt out. So the whole concept of this weekend, it's a bit of I like to think of it as it's a licorice all sorts. It's something where if you're a particular style of osteopath, you're going to walk in here and you might go, well, I'm not really interested in that, but you're going to have the 2 hours with these lecturers and suddenly go, oh, that's interesting. That's actually different from what I thought that's what about. And vice versa. So it's something for, the cliche, it's something for everyone. And if we've got such an experienced load there, starting from George, who's been doing this for 45 years, from Michael, who's 35 years plus, and everyone else is, but in that 30 plus. And also we've got Paula Henderson, who taught visceral osteopathy at RMIT for 10 years, and she's talking about more quite specifically working on the kidneys and adrenaline system in relationship to the autonomic nervous system. So
sounds like you got a mini convocation there going on.
It is a mini convocation. It's probably the frustrating thing is going to be that people are going to go, geez, Paula she was a lecturer last year, and the response was, oh wow, we wanted more time from her because she taught us some stuff which we want more time. But it's a chance to get everyone just inspired by what we have as a profession, which is a unique profession which we've got to instill and not let it get lost by the concept of manual therapists. Osteopathy it's a complete system, and we should be proud of that. And it's a lot of the osteos who have been doing this for many years can share with them the guidance of the importance of how you can actually activate healing and working with the autonomic nervous system. We know working with the vagus, we know working with the sympathetics, it's what allows getting rid of inflammation. It activates that whole cytokine factors in relation to inflammation. It's all about what osteopathy is, which is healing via the blood, and that's where AT still talked about lymphatics, healing through the rule of the artery supreme. The cerebrospinal fluid, again, another important factor. So we tie all that whole fluid in together into an experience which hopefully every osteo will really enjoy.
Yeah, no, amazing, mate. When's this happening this year? Just to give it a bit of a plug, just so people that
November the 7th and 8th of November. And it's Friday. It's a Friday and a Saturday. It's at the Mora Hotel, which is a sort of 4.5-star hotel in Richmond. So it's sort of close to the CBD, near the Yarra. So if it's all too much for you, you can go for a walk on the Yarra at lunchtime. But we have a full lunch buffet there we've got morning tea, lunch. So it's it's a good quality hotel there, which we encourage people to come down. And on the Friday night, there's a pub across the road called the Bridge Hotel, which you normally have a few drinks and dinners with afterwards. So the guys who you want to talk to more, we encourage the lecturers to come to that, so you can chew their ear off afterwards. And it's, again, quite a social experience with about 40 students. So the ratio is, there's a table trainer for every 1 to 4 ratio. So there's a lot of experience in the room.
Yeah, great. Definitely encourage that, and everything that Tim just said also about, I think, encouraging the philosophy and the principles of osteopathy, and making sure that doesn't get lost on this current generation. Especially from what you mentioned earlier as well, the way where education is kind of stripping away some of the things that previous osteopaths were taught. And I know that you can only speak to RMIT because that was your experience.
Yeah.
And so it's good for people to understand what the 1 or 2 generations before them, what they went through and how they think, because obviously it's different because they were quite distinct back then from the other professions, and it's just good to have all that stuff in your arsenal. I mean, there's nothing wrong with understanding rehabilitation and doing all that stuff, but if you have some of all that stuff as well in your arsenal, you're going to be a much more complete therapist.
Yeah, definitely.
So yeah, definitely go and do that in November if that's something that if any of those speakers there kind of impress you. Definitely do that. I want to go back and I guess speak to you. You mentioned earlier about education and about how one of the things that would have led you to start Fit for Practice, and I'm assuming this is because that's what led me to start Success in Practice, right? And is that you must have seen a gap there, Tim, in the market in terms of actual osteopathy and getting osteopathy to work for the osteopath. Did you find that there was some things that were lacking, and you thought, hold on a sec, they're not being taught all this stuff, let's get together and teach that to them? Was that one of the reasons why you started Fit for Practice? Hello everyone, just a quick break to give you some information on where to best find me. The first place is the private Facebook group called the Successful Practitioner Pathway. I've set up this private group as a place where practitioners can go and get tips and advice on how to best accelerate their practice and improve their clinical practice skills. The second place to find me is at successinpractice.net. That is where the Success in Practice signature program is housed. You can find more information about me and how I can best help you achieve success in your practice. So the two best places, the private Facebook group, the Successful Practitioner Pathway, and successinpractice.net. I will link to both those places in the show notes, so for more information, please see the show notes. Now, enjoy, and back to the show.
That's exactly you just nailed it, basically, where, as I was saying before, with when Danny and Miranda and I were chatting away, we're just saying it's a shame these 4th year, 5th year students aren't being exposed to it.
What did you think was missing? And what do you think is missing? Because you're still seeing students now.
Belief of... I think there's a lack of belief of what the potential of what osteopathy can do to the body, and how we can activate the physiology. I mean, to me, the science of osteopathy is basically anatomy, physiology, all mixed together. And I think a lot of the younger guys,
board, right? Like anatomy and physiology doesn't just belong to us.
It doesn't. No, it doesn't belong to us. But I think learning how to activate it. And whether you're working on the diaphragms of the body and saying, okay, let's get someone breathing better. We've got a patient myself who's they've had influenza, they're run down. How are we going to reactivate them? And that's where I think the fluid dynamics and getting your diaphragms working for your body, we know we can make an impact on your body's drainage and also nervous system. We're going to have Tim's a bit burnt out. What are we going to do here? We're going to tell him to go on holidays, and we're also the biopsychosocial. Because we've got time with our patients, we've got ability to work out where they're at to, and assessing them how their systems are working. And so look, that was exactly what you said. We just felt there was actually a lot of people who'd probably who were about 3 or 4 years out and getting a bit lost on believing they could fix people, and then finding out they weren't fixing people. And that's where we thought, well, we've got to go back to the basics, and whether it was exposing them to simple things like a articulatory model of, to give someone a GOT, which again is the general osteopathic treatment, which is taught through ESO, and that was a big part of the RMIT work, which just activates us more. At the time, I didn't actually get it, and I've got it later in life that it's a complete sort of treatment where you're just getting, by working through all the different articulatory parts of the body, you're just basically shifting fluid, you're draining off areas, you're getting inflammation out of the system, and you're bringing fluid in. So we know the pressure system of the way our body works. If you're articulating legs and knees and ankles, hips and pelvises, releasing off sacrums, you're going to get a whole change in the way your lower limb's going to work, and through to then working through your diaphragm and working on the rib cage, rib raising. We know that's going to affect the sympathetics, and then scapular work. So that's sort of treatment which I enjoy doing.
What do you think has caused all this, Tim? You said there was a lot that was missing, and there was a gap in the market. Why do you think this happened? Like, what do you? I mean,
I think from what I can work out, the funding, university fundings was cut. Maybe the people who were teaching, I don't know many of the teachers there now. Maybe there are new grads who are coming back to teach who potentially haven't had as much experience as someone probably like myself who's been out for 30 years. And I mean, and then you could ask me, well, why aren't you teaching now? And I'm going, because I'm too busy with my own private practice. And I think, and some people...
episode 23, you mentioned John Pitcher. You spoke to John Pitcher when you were a student.
Yes.
And I had him on episode 23, and he said that he would donate his time to go and teach at RMIT, and
there you go.
I thought that was, and I think there's a lot out there, especially, you're bringing a lot of practitioners who are looking at getting on to retire. A lot of them are happy to give back. They don't want a lot.
Well, that's the original group of guys we taught were those guys who are starting to retire, and now the teachers who are there now are very much probably in their prime, really. They're all been out for that sort of 25-year plus mark, so they know their information really well, and they're great lecturers, and they're in their prime. So it's great. But it'd be good if you knew if John wants to, someone should be contacting him and saying, hey,
yes.
Or they should have programs where it'd be nice to see people like even like people being invited to go back to university and saying, hey, we've got an open workshop between 2 and 5 on a Thursday. And this speaker's going to come. So there's a rotating group of lecturers, and that's where at RMIT we would have that with the Sydney osteos who would come down. It was the Steve Porters who inspired me when I was in like 4th year. It was the Jeff Morrisons. It was the Roman Mazalaks. It was those guys who were ICO trained osteopaths who inspired me to think, well, that's why I'm going to move up to New South Wales to learn this. I thought their system seemed to make more sense to me than perhaps a more conservative style of treatment.
Okay, so I guess you saw there was a gap in the market, and you're thinking that it might be due to a bit of funding issues and maybe some issues in terms of a transition, I guess, from the... there was also a bit of a transition, from what I understand, from the Ray Myers kind of era,
I think
into what we know today. I did speak to Azruddin, who's the head of the RMIT program, who worked closely under Ray, and he mentioned some challenges. People can go back and listen to that episode. There are some challenges there, and we did touch on the internship model as well, and I think he might be working on something to kind of bring that back in a much more powerful sense. What do you think about that, Tim? What do you think about the internship model moving forward? Because there are pressures on university, and some of those pressures we can't, like, they're going to be bigger than we are. They're bigger than us. They come from government. They come from, we're a small fish in a big pond, and we seem to always punch up, which is fantastic. But sometimes, we've got to come up with some more innovative ways to hold on to osteopathy. The
Yep.
internship model to me seems like a very good way to be able to do that. Give us your comments on that, Tim.
Yeah, well, I've had the last 4 years. I've had an intern working with me over the last 4 years, for normally about 6 months, and those osteos who they're still in contact with me because not all of them have stayed on at the practice. The others have gone in state and stuff, and so they I think they always come back to Melbourne. They always contact me and we go and have a drink and catch up, and we share stories, and I think as an intern you get to hear your osteopath communicate to their patients, and I think that's a really important part about communicating and learning the language of how you sort of talk to your patients, and that's where you learn. And I think prognosis, they're the sort of things which I remember being out when I first coming out. So how patients going to ask me, how many treatments is going to take me to fix my acute lower back pain? And it's just those little sort of those keys where you can say to a patient, look, I'm confident by that third appointment you should be feeling significantly better, and if you're not, then we're going to do some more investigation of why you've suddenly got this spontaneous lower back pain, blah 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 blah. But it's that sort of the wording of your communication for patients is really important for those new graduates, because again, sadly, I don't think my daughter actually has just graduated a year ago. Sammy, I haven't told you that, but she was an RMIT.
Congratulations to her.
Thank you so much. And most people have said to me, she's going to take over your practice so you can retire. And she has very cleverly working at 2 other clinics with great osteopaths who are going to inspire her. So she's very privileged to have
Where's she
two
working,
great.
Tim?
She's working at Osteo for Kids, the children's clinic in Ringwood, and Osteosense in Fitzroy with Leon Kuhneman and Christopher Val in Ringwood. So yeah, she's having a great time with those practitioners. Yeah, but yeah, talking to her and just seeing that she'd be seeing one or two she was seeing 1 or 2 patients a week in the student clinic, and then maybe doing an observation with another student to get her numbers up. Because I think if you observed students, you could get that as I've seen that patient. So look, I didn't think they were seeing enough to just get that clinical.
That COVID, they're still really post-COVID, but
there was post-COVID. Yeah, it really wrecked that generation of kids and for their education. And then maybe the profession should have called out to say, hey, come on, you've got to go and see more osteopaths, see how their clinics work. And I've had in the last month, I've had 2 students come in do observations with me, and I actually enjoy having them.
It wouldn't be a bad spend of money. I think it wouldn't be a bad way to spend money as an association or as a profession for us to actually put something together just for that generation of osteopaths. Like, I think if you graduated in anything from this year and the last probably
3 years,
4 years, 4 years.
Mm.
Let's put something together for those people free of charge, and get them to obviously just bring up their skill set, give them some inspiration.
Yeah.
I don't think that'll be a bad spend of money. It wouldn't actually cost a lot of money, and a lot of people will probably just donate their time.
I think you're right. Yeah, it could be the COVID crisis. Could be called the COVID crisis seminar. Fill in the gaps, or it's probably a little bit like we've done with practice, that you've got a big wide range of teachers who could give their time up just to
definitely
give us.
I'd be happy to, and you'd be happy to, and I'm sure a lot of people would be happy to. That's definitely something. But that, like I said, that wouldn't be a bad thing for the association to get behind. I think that needs to be profession driven. I want to ask you about
Diz. That's sorry, the dog.
That's right. That's right. He wants to get on the show, does he?
He obviously is missing out on the show. Disney. Yeah.
You got Netflix on or something in the background. He's jealous.
He's just. I think someone's out there. I think he's just hearing someone.
Yeah, right.
Yeah,
Mate,
sorry.
I want to finish off by asking you about, I guess, just the general landscape of osteopathy in Australia. What do you think are some of the challenges? What don't you like at the moment, and what do what is it that you do like? So I guess we'll try to end on a good note. What don't you like at the moment about what's going on in osteopathy? What would you change?
Yeah, I think. I think the sad story when I hear about students who are just. I've heard stories about them saying, hands-on work doesn't work. There's not enough evidence. So those lecturers who might be downcasting the efficiency and the effectiveness of osteopathy, and I think there's a lot of research coming out in Germany and Italy on the efficiencies of osteopathy, and they're great because those guys are basically physios who then do postgraduate workshops in osteopathy. So their ability to work in hospitals is they've got better access to hospitals. So there's quite a bit of research going on there, which would be great when that all comes out. But in Australia, look, it's sad to hear people don't trust the process. And I suppose I try to, when I do have students who are a bit sort of like, it's all very hard, and it's hard, and you hear stories of them going, oh, most osteos only do 2 or 3 years and they end up getting a job working for TAC. And I mean, maybe that's that some people find clinical work hard work. It can be hard work, and it's like, you're meant to be the trained psychologist, you're meant to be the exercise physiologist, you're meant to be someone who's we have to be a bit of everything, and it's for some people it's a hard thing to be that all-round osteopath. And some people just find, and being with people, it can be draining to have, if you're seeing 10 to 12 patients a day in, day out, it can be quite an exhausting process. And I've had to learn myself ways of just disconnecting from the patients, whether it's washing your hands between patients as a way of getting rid of that energy, because some people are energy sappers, and that's rituals of going for the walks to sort of get rid of all the bad stuff which has happened during the day. But I'm confident that post-COVID now that we can get back into trusting the process, and I think osteopathy we've got a lot to offer, in particular with just encouraging that sort of healing, which it's been lost a bit on the Diz. Sorry about that. There's someone. I think there's someone at the front door. Do you mind if I get it for a second? Yeah, what's it?
That's fine. I can edit all this out.
Oh. Sorry. Yeah, it's all right. Sorry, Sammy.
You're right. Just make a note.
Sorry about that. Are you there?
Yeah.
Yeah. So, and look, the things I like about the profession are now, we're talking about before, there are lots of workshops. There's the Bowerbird organisation. There's a lot of postgraduate information where practitioners can be inspired to learn more about what osteopathy's got to offer. We're a very privileged profession, and I think we should be just enlightening the younger students who think we're just manual therapists, and we're not manual therapists. And I think that's obviously that's the push where I think RMIT's now got physiotherapy coming on board there, which that'll be interesting to see how that all works out, because the chiropractic course is closing down. So that'll be interesting to see how that all works from how our professions go. Yeah. So look.
So Tim, let me just clarify. When you say that we're not manual therapy, you mean that? I mean, can you just clarify that point? Do you mean that we are not a bland form of manual therapy, that we're just only hands-on and that's it, and we have no, I guess, philosophical underpinning behind what we do, or do you mean, are you actually saying that we're not manual therapists?
No, I'm saying we are manual therapists, but we're a part of osteopathy. To me, is that we're dealing not just with pain, And I think that's where pain science is. Like a therapist might be just treating a pain syndrome. As osteopaths, we are activating the body's physiological process to heal. And I think, whether you work on fluid dynamics, through drainage, through decreasing inflammation, and working with the body as a whole unit is, to me, the lost skill, where a lot of students, particularly new graduates, they're just basically treating a lower back. And that's where I sort of have to pick up my associates in saying, okay, we've got low back pain, but where's the source of it? Where's it coming from? Is it the pelvis? Is it the hips? Is it the knee? Is it the feet? Let's get the patient. I always just go back into the whole thing of, like, as osteopaths, we're just trying to treat. We're not just treating a pain syndrome. We're treating the whole system, and also thinking about what the physiological benefits of what how you can empower the body to heal through lymphatic work, and through cerebrospinal work. I find that's a really powerful way of activating fluid dynamics in the body, and so to me, it's not just about getting rid of someone's pain.
Yeah, I kind of knew that's what you meant, but I just wanted to clarify for the listeners. We do manual therapy, but we're not just thinking manual therapy. We are thinking on different levels in terms of what you just described earlier.
One of my great sort of things I was, when you treat someone with chronic low back pain and they sort of say, how's the back pain going? Oh, it's going great, but what's even better is now I'm going to the toilet much easier. Exactly. I'm now going to the toilet every day without an issue now. But for weeks I've been struggling with that. That's all hasn't gone. That's not working. And so the interaction between structure and function, those original philosophies which AC still put out there, it's an appreciation of how that all integrates with the body.
Yeah. Tim, normally I ask the guests what they think osteopathy is and what an osteopath is, but I think you've just answered that quite well. So
thank you.
I'll skip that question, and I'll just go on to say that thank you for the evening, thank you for tonight, thank you for the recording. Again, everybody, if anybody wants to join Tim down for Fit for Practice, it'll be at the Amora Hotel in Richmond on November 7th and 8th. And it's going to be, there's a wealth of experienced practitioners there.
8 speakers.
And it's going to be, you'll get really good, I guess, student to practitioner ratios there. And you'll get lots of hands-on experience. And so I encourage you all to do that if that's what interests you in looking at the speakers that Tim's putting together. Tim,
last thing,
words, mate, for you.
Final words for me. I like to do a little bit of a book review. That's why I had those books out before. This one has just come out. Osteopathy in the Blood. It's 40 years of work from Maxwell Favell. I only got this copy last week, so very excited to read it. There's other contributing authors, Alyssa O'Brien and Michael Solano, who'll be also
on the podcast.
Has she? Oh, great.
Yeah. Lovely.
So,
lovely lady. Shout out to Alyssa.
So this is a go-to. There was a bulk order that got through, I think through Austria Australia that did it, but that was through Anna Walton in North Canberra, Australia. I'm not sure if there's any more copies, but look, so far I'm loving this book as well. And, it's just great to see his hard work being put in together. The Rule of the Artery. This is basically the Rule of the Artery courses.
Get these books on your shelves, guys. Get them in your hands. Don't get these digital copies.
I love a book. I love to just flick through, and even certain just pick out a page and just go, oh my god, the embryology of the heart. The whole interconnection between how that works with our development. It's just incredible.
Yeah.
So
it's
look,
all there for you, everyone.
And the last final words for you, Sammy. Thank you for having me on the show. And hopefully this is my 30th year of practice, and I feel like I'm still learning. I'm still enjoying learning, and it's sad when I do hear stories of patients who also people say I got bored of doing osteopathy, because if that's the case, I think they may not have actually fully worked out the potential of what we've got to do with our patients, and how there's the journey can just keep going, and never stop learning. And my pet hate is saying, when I hear someone saying, "Oh, I've got my CPD points because I did them all online," and learning online versus getting into seminars where you're actually meeting new osteos, interconnecting with. It's the socialization. Sometimes it's the tea break where someone says, "Hey, what's your go on the clavicle? How do you work on a SCM? What's your favorite technique for that?" And it's someone who might say, "Oh, I love doing this one," and that's the take home for that seminar, not even from the lecturers, but it's the interaction between our profession. So I think hands-on, being in courses is definitely much better than going, "Oh yeah, I've got my CPD points up through watching videos and stuff." Yeah, beautiful.
All right, mate. Well, thank you for the evening. That's all right.
Thanks for having me on. And how do I get a copy of your T-shirt?
Oh, mate, it's actually so if you go to the show notes, there's a link in the show notes that you just click and go there and you can grab a shirt.
Okay.
Very easy. So jump on. It's either you can go on YouTube or Spotify or Apple Music, and it's in the show notes. So just click on the show notes, and there's a link there.
I think I've seen the one, Keep Calm. You'll go see an osteopath. That's quite a cute one too.
Yeah, that's a good one. So yeah, that's. But yeah, definitely get the shirts, guys. They're out now. I think there's a couple of different colours there that you can choose from. Basic colours: black, navy, grey, that kind of thing. But yeah, Tim, thank you for joining me tonight. For starting along with me, for everyone else, have a good evening, and I'll catch you on the next episode.
I would catch you this weekend, but I'm actually going to be away this weekend in Melbourne. Otherwise, we could have caught up and had a chat.
I'll be back.
Yeah. Well, let me know when you're coming back down to Melbourne.
Will do. All right, mate.
Yeah. Okay.
All right,
thanks,
everyone.
Sammy.
Have a good night.
See you. Good night. Bye bye.